Meeting is called to order. Good morning. Good morning.
Good morning.
You all awake? Ready to go to work?
Yes.
Okay. Notice of one thing, Commissioner Coher, he's running a little behind, but he will be here. We will ask for Commissioner Woodhead to do the notice of meeting statement.
Statement of announcement. A meeting notice announcing the date, time, and place of the May 16th, 2024 Commission meeting was distributed May 14th, 2024 to the appropriate media and other groups or individuals who have requested notification. The announcement and agenda were posted at the Department of Disabilities and Special Needs Central Administrative Office and on the website. American with Disabilities Act. The public has been notified that accommodations such as interpreters, mobile ability assistance, or other assistance will be provided to individuals with disabilities and special needs if requested in advance.
Thank you. Okay, everyone have had a chance to look at the agenda. I need a motion to approve.
So moved.
All in favor?
We need a second. I'll second.
Second? Okay, all in favor?
Aye.
Ayes have it, so ordered. Indication by our Commissioner Malphus.
Thank you, sir. Let us pray. Dear Lord, thank you for allowing us to be here. We pray that each commissioner here and each first that each commissioner here would realize the privilege that we have to be here and to help those with disabilities. And we would also pray for each person that has a disability. Today, what's been particularly laid on my heart for this is for me to pray for each person's independence, that their independence would increase for each person that has a disability of any kind. I realize full well, since I have a disability, that could mean anything from tying your own shoes to getting a job, getting a paying job. We would pray that your independence would increase throughout your life, and that you would do all that you could to make that to happen. We would ask that I would pray that you would become personally acquainted with Christ, and that He would change your life in that way, and because you would get a understanding that you cannot get otherwise. In Jesus' name I pray. Amen. Amen.
Have two approval of commission meeting minutes from February 15th, 2024. I need a motion to approve.
I move that we approve the minutes. I'm fine with them.
Second?
Second.
All in favor? Ayes have it, so ordered. Commissioners update. Commissioner Malphus, start with you.
Thank you, sir. I appreciate that. I was going to give a couple of other updates. I think I can wait till next month on, but the update I do want to say is that, or what I do want to say in regards to the update is that I would like to thank the staff for their efforts. I know that this has been a very trying time for the commission and for the agency with the possible changes coming or not coming, we don't know yet, regarding the legislature. And I just want to commend those that continue to work hard to do all that they can for those with disabilities. And I would like them each to realize that the people with disabilities need you, and they need your help in whatever capacity that you work in. But the last thing that I would like for them to realize is that one thing I've learned in my life, throughout my life with a disability, is that nothing, and I mean nothing in this world, is easy. Nothing worthwhile is easy. And so anything that you do for DDSN is not always easy, but if it's worthwhile, it'll never be easy. Thank you.
Commissioner Thomas.
I'm here. And I have been
diligently at work trying to get together, interested, and we'll talk about it sort of later, but I think this is part of, sort of what you've been doing and all that. And I've got their floor documents from 9:15, and the last few days of the session was, if you all kind of follow, it was very interesting. It reminded me of the old days and why I'm glad I'm not in the Senate anymore. So anyway, I've got enough stuff there to keep me busy for a while analyzing precisely what's in the bill, but I think I pretty well have kind of gotten it in my mind, because I have descriptions, short descriptions, full descriptions from a Medical Affairs Committee and Gene Hogan. So this is accurate stuff I've got. And I'm not quite sure where our executive director is on just good reading material at night, but if she doesn't have enough, I got a bunch for her. Yet I think I'm about 95% now understanding precisely what's in the bill and without guesswork. So, Mr. Chairman, thank you very much.
We look forward to your input.
Thank you, sir.
Commissioner Woodhead.
Yeah, I have a few things that's happened over the past few months. I know that Chairman Miller and I spoke on Advocacy Day at the State House, and it was an honor to present. I came from, the spot of being a mom, and, talked about how important adaptive sports is in our communities. So it was really special to be able to talk about that. And then I attended the Trauma Survivors Roll Walk Run event with my daughter, and that was a lot of fun meeting other people and being able to talk and advocate. Clemson, our own Clemson, we attended the National Wheelchair Tennis Championships in Florida, and they did really well as a team. So they had more wins than losses, but that doesn't count. But it was really a fun event to be able to participate with 10 other universities throughout the United States, and to have South Carolina represented was a pretty big deal. And on a personal note, I moved my daughter into Richmond, Virginia for the summer. She's doing a recreational therapy internship for the whole summer. And it's a pretty cool thing. She got her first ADA apartment. Luckily, they had one available, which was amazing. So she's probably never going to want to come home. So she's there until the middle of August, and obviously has a different perspective that she can help out people since she's in a wheelchair, and adaptive sports is so passionate for her. So I'm really excited for her and want to bring her back to South Carolina. So that's it. Thank you.
Thank you. Commissioner Coher, any updates?
I had retired. I'm surprised I'm here.
I'll second that. I don't have anything to add. Commissioner Woodhead and I, as she expressed already, and it was a wonderful day with quite a bit of excitement. And it's all for a very, very good cause, and we are appreciative. I see we have Carol Stewart, and I'm sure that you and Commissioner Thomas gonna have a lot of fun along with Rob McBurney. So that should be interesting. Okay. Public input, we have none. That's my understanding. No change. Okay. All right, we down to old business. Quarterly incident report. None other than Ms. Ann Dalton.
Good morning.
Good morning.
So I have your quarterly incident management report, which can be found in tab 3 of your notebooks. I am, I suppose, happy to report that for the third quarter in fiscal year 24, The reporting rates for allegations of abuse, neglect, and exploitation, critical incidents, and death reports are very consistent with what we had projected from prior quarters. When I ran the numbers for this quarter as compared to our February projections, when we were looking at the annual rates, we're right on target, plus or minus 1 or 2 reports. So we're right where we expected to be. While the fiscal year 24 numbers were initially higher in the first part of the year, they have stabilized across all areas. For abuse, neglect, and exploitation within the community-based service areas, we continue to average about 50 individual reports and among 60 to 65 allegations each month. About 25 to 30% of those allegations do result in some sort of administrative finding. Typically, we are finding issues related to supervision or dignity and respect type issues found by the Ombudsman's office. There have been 5 staff arrests related to allegations of abuse, neglect, and exploitation through the end of the third quarter in our community-based settings. And we have had 978 critical incidents reported throughout our system. We continue to have a decrease in the number of law enforcement calls as compared to prior quarters. And unfortunately, there have been 79 deaths reported in our system, with the overwhelming majority being due to circumstances in which the death was expected. I am pleased to report that we have a number of training initiatives in the works. Of course, our training for provider staff on basic orientation and annual training is a concern, as well as the abuse, neglect, and exploitation training. We are pleased to work with Intellectability to develop a new online training course related to abuse prevention and reporting the allegations of abuse. This new training will include periodic knowledge checks within the curriculum, and it's expected to be available hopefully by the end of the calendar year. That is somewhat of a moving target, but we continue to work with Intellectability on the content for that course. They have also made available free training for our providers based on the Fatal 5, which are 5 diagnoses or incident types, which often lead to higher mortality rates. So this is a free training. It allows for free continuing education credits for our provider staff, and it deals with topics on the risk for aspiration, dehydration, dysphagia, bowel obstruction, seizures, and sepsis.
Can I ask a quick question, Mr. Chairman? Are the 37 DSN offices, is this available to them and to the statewide office staff? So it covers the whole gambit?
Yes.
It's the only question I have. Very good. Thank you.
Yes, the training is made available to all of our providers.
Universal training. One quick little follow-up. And does it apply to, let's suppose you're looking at even janitors or food service workers and all that. Do we have them going through the program too? Because they've got accessibility, and so you don't discount them just because they're not directly hands-on.
Correct.
Okay.
Anyone in the system will have access to this training.
I mean, the danger is you go to work and you don't quite have it in your mind. I better be careful how I treat people. I could get arrested for mistreating somebody. And I just, you come in from outside, you've got a naive view of the world and you snap at something real quickly, Well, it's not quite like you're in the 11th grade where you're getting a fist fight with somebody. No. You can't do that here. Here you get in trouble, big trouble. Okay, I just think I just wanted to explore it. Thank you very much, Mr. Chairman.
Anytime.
So in addition to the training that we are partnering with Intellectability to provide, we also have a partnership with the Council on Quality and Leadership, which is another nationally recognized organization. And they are also offering free training to our providers on the topics of person-centered training and human rights committee development, inclusion practices, individual personal outcome measures. They have a training, there will be 9 trainings over the next several months, and the next one is actually on May 22nd, next Tuesday at 11, and that particular training is on the topic of inclusion. So we continue to promote those trainings. And we are working with the state long-term care ombudsman office through their regional network to provide trainings for our provider agencies. We recently participated in a training up in the Greenville area with the ombudsman's office. It was very successful as we talked about not only the DDSN reporting process and our responsibilities, but also the investigation process that works through the ombudsman's office. The state law enforcement division has also been doing training for our providers. They recently completed 5 different trainings across the state and are open to going out to individual provider agencies to continue to provide training wherever it might be needed. So lots of training going on. There are new regulations that have just come down from the federal government that will also impact our incident management reporting, and we are anxiously awaiting further guidance from the feds about how we will be implementing that information. Any questions?
Commissioners, you good?
Thank you.
Thank you. Thank you very, very much. Ms. Hayward. Mr. Jamie Hayward. How are you?
I'm doing well, thank you. Good morning.
Good morning.
The quarterly incident management for the regional centers that I'm sharing is data that's collected for the third quarter of fiscal year 2024. Within the 5 regional centers, DDSN averages about 14 A&E cases a month. 100% of those cases have at least one or more policy and/or procedure violations identified from the administrative review. In the third quarter of fiscal year 24, there have been 2 staff arrests related to A&Es. Critical incidents. In the third quarter of fiscal year 24, there have been 32 critical incidents reported at the regional centers. Deaths, we have a total of 8 death reports that have been identified or that have been reported in the third quarter of 2024. So that's all I have on my end.
Commissioners, any pressing questions?
Are those deaths, Mr. Chairman, well, are those deaths from natural causes, or are those some kind of intentional where we had to call SLED in?
Yes, so I don't have any information right here in reference to the deaths, but most of them are natural causes.
And that's the 5 centers that are for disability special needs statewide.
Yes,
It's not the 37, any of the,
Okay.
do we have data on any of the 37 contractors?
that will be quality management.
Okay,
Ms. Dawn.
Yes, sir. We have had 79 deaths through the end of the third quarter
From
in our
all
community
to
base.
get, I'm sorry.
In our community-based settings, so that would include the boards and our private providers. And well over half of those were due to causes in which the death was expected. And just as a point of clarification, for any resident of a DDSN contracted facility, whether it's one operated by a board, a private provider, or a regional center, all of those fatalities are reported to SLED, to the Vulnerable Adult Investigations Unit. The SLED agents do collect information regarding each and every death, whether it was expected or not. And they also refer those cases to the Vulnerable Adult Fatality Review Committee. So there are a number of different reviews that occur for each and every death that we receive at this agency.
And abuse also. I'm presuming that this annual report will include, this is a DSN, basically a DSN report, Mr. Chairman, I think. I'm presuming that's going to be, Brother Bernie, you're going to be talking about that in just a little bit. But the totality, I think, is of some interest, probably to the commission. Also, not only the deaths, but instances of abuse and neglect and things like that. Absolutely. So, which we have been on top of for years now. And quantifying and making sure that's all. You know, we've even talked about cameras and all that sort of thing, trying to deal with how to make sure that we're on the cutting edge of any problems. So thank you very much.
You're welcome. Any other questions for me?
If you don't mind,
Go ahead.
He just brought up an interesting point, is all of the camera situation is all the way we want it to be now, right? I mean,
Yes, sir. So we continue
it's
to
all
work.
redone and in all of our regional centers?
Yes, sir. So the FAs continue to work with our IT team here to identify any spots that had like blind areas. But as far as the cameras that we have access to when we're reviewing the A&Es, we haven't identified any weak areas where we aren't able to identify any incidents that we need to view.
Thank you.
Yeah, from this commission to the executive staff, hats off.
Any other additional questions? Thank you.
None other than Mr. Robert Max. Bernie? You have it, sir.
Yes, sir. Good morning. I'm cognizant of, when I was giving briefings in the military, I was, one of the first things people told me about giving briefings, the first word in briefing is brief.
You're talking to a former Air Force captain.
I know it, you know what I'm talking about.
All right.
So, I will try to be brief, but there was a lot going on this legislative session, so we'll cover everything that we were involved in with the legislative session. Starting with our regulations, and I know the commission has we've had a 2-year journey to update our regulations of this agency. We've alluded to it in the past, the 1980s call, and they want the regulations back. That our regulations have not been updated since then, and I'm pleased to report that we had our regulations, our last 4 articles that we put through this legislative session, went through without any trouble, never had to make any changes or any withdrawals or anything. So that was something that a lot of agencies can't say. This legislative session, there was a lot of going over with regulations. The questions were really good at the hearings, and we had really good hearings from the House and the Senate on it. And I am pleased to report that sometime in the next month, next week time frame will run for the regulations, and they will be posted onto the legislative website sometime in the next month or so. I want to thank Ann Dalton, Becky Peters, Susan Davis, and Janet Priest for the work they did going through the regulations. It was the drafting of these regulations was very artful and purposeful and effective. So I want to thank them for that, and also would be remiss if I didn't thank my lawyers, Carolyn Benson and Aaron Oler, for getting me through the process legally, and again make sure that we have everything, every I dotted and T crossed in that regard. So that's a win that we've been working on for the last couple of years. So I'm pleased to report that to the commission. Second thing I want to bring up is the budget. The House and the Senate have both had their cut at the budget. The House has had their second cut at the budget. And we had 3 main priorities that we asked for in our budget. We didn't ask for a whole lot because we knew that the legislature was going to they already had an agenda for our budget. But I'm pleased to report that the House funded the fiscal manager ask that we asked for, and the Senate also funded that in their budget as well. So we're good on that. I feel fairly confident on that. The Senate added our rental assistance program that we've asked for. That's for the rental assistance for folks that aren't that don't have SSI payments coming in until they get their payments coming in. There was a system where we could kind of front up some money to allow that to happen. The Senate has funded it, the House did not. So we'll see how that comes out in the budget in the conference committee. It's going to a conference, and you never know with that. So So we'll see how that goes. But one other thing that, the main thing that, the main amount of money that we got from the legislature this year in all of the healthcare agency budgets that are moving to Otari, we got the rental, we got they gave us $6 million in the budget for our lease payments over at Otari. And they also put money in the Department of Administration's budget for our moving expenses. So that is all covered in both budgets, the House and the Senate, and the House too. They've covered that. They've put in provisos that are needed to cover us being able to make those lease payments. So that is all done. We are set to move. That was the last piece that we needed to fall into place before the central office move. So the central office move will be happening. Don't expect the governor to sign that, so that won't be much of an issue. So we will be moving, and so the timetable for that will start on July 1st. That's when the lease starts. So we will start making our lease payments on July 1st of this year, and then thereon after. But that does not necessarily mean we're moving central office in July, though, because the Department of Admin has is in the process of interviewing property managers. So we'll have a property manager over at the Otari building. And if you haven't seen the video and the pictures of it, it's a very nice building. We will be there. There are 5 buildings there. We will be in one of the 3 main office buildings there, and then there's shared space in the other 2 buildings. So we will. The property manager will be handling all of that. Department of Admin's timeline for that, they said that they don't expect anybody, they're gonna have to get IT and everything set up before then. So they don't expect anybody to be moving until the actual first of the year physically. So we will be getting ready for that beginning next month. And we'll get some instructions from the new property manager as to how that schedule is gonna work. So that's included in the budget, and it's gonna, it's fairly solid there in the budget. So that will be happening. Does anybody have any questions on the new building?
Commissioners, any pressing?
I only have one quick question.
Go ahead.
What is the address of the new building? Just so I-
400 Otari Parkway.
That's a pretty nice dig.
It's the former corporate headquarters of SCANA. Built in 2018. SCANA really only occupied it for a short amount of time, so it is fairly brand new.
So is our state director smiling?
Oh, I mean, it's a beautiful building.
What about the executive staff? Are you smiling?
They haven't seen it in person yet.
Yeah, there are a few of us that have seen it in person, but we'll be able to take people over there, I think, after July 1st, when we start making lease payments.
Ms. Priest have a real nice office, larger than the one behind you.
Like I said, I make no promises on offices, but we'll deal with what we can get there, but everything is very nice over there.
Go ahead.
I do have a question. On the piece that they turned down where the House didn't approve it and the Senate did for the Social Security Disability funding assistance, and it's going to the committee next, how long does that process take, and what are we doing with those people? They're still getting turned down on the open beds?
Well, okay, so that's a program that it's one of those things that we would prospectively like to start doing.
Right.
That we think would help as far as getting people placed with providers. It just, if it doesn't get funded, we won't be able to start that as soon as we would like to. But in the conference committee, there's always a process in the conference committee of deciding, this gets funded, this doesn't. It's basically horse trading between the House and the Senate as far as what their priorities are for the budget. And Senate gets some of theirs and the House gets some of theirs. Occasionally, the Revenue and Fiscal Affairs Office will come in and announce we have new money. And they did that 2 years ago with the budget. Everybody got everything funded. It was that was a very happy meeting. I remember that. Everybody walked out. Everybody's getting everything funded they wanted. So those things can happen. I don't know what's going to happen this year or not, but those things do happen. So it's fluid whether or not that would get funded or not. But once it's in one of the two versions, it's possible that it can get funded. Anybody else, any other questions on that? And before I move to one other budget item.
Can I ask one last thing, very quickly. I guess I could talk to Quincy about this if you don't know, and it's fine, because I don't think he's in here right now.
They had to go to a funeral.
Oh, that's fine.
Yeah.
But sorry to hear that. That's bad. Makes this seem small, but what I'm saying, but I was just gonna ask, I know he had talked some months ago about the room and board funding that we were trying to increase for people that we didn't get room.
Right, I think that's what he was talking about. Yeah, that's what he was talking about, that's what this program would.
Okay, I didn't know if it was the same thing. Okay,
would do. And so it's one of those things where, like I said, it's possible that we can get it funded.
We'll see.
We'll try.
All you have to do is watch the head nod of Ms. Laurie over there. We good.
So, one other budget item that we have, it's a fairly big one, one that that came to us by surprise halfway through the session. Senator Bennett and Representative Gil Gatch, Senator Sean Bennett and Gil Gatch we took a tour of Coastal Center in March. And we went through the buildings that that we were working on, need to be renovated. Andrew's going to talk about the CPIP program that we have, where we've moved a lot of money into the CPIP program to really aggressively bring up to date a lot of these older buildings that we have at the regional centers that need a lot of work. But the CPIP program is very time consuming. There are hoops that you have to jump through. You have to go get an approval, and then maybe you wait for a little while, and then you have to get another approval somewhere down the line with the time frame with it. We discussed that with the legislators as they toured, and they said, well, if it's not a problem of money, if you have the money to do it appropriated, why can't we just get the process out of the way? And so we had a very productive meeting. Constance and Rick Harmon from the Joint Bond Review Committee with Senator Bennett, and we discussed what it is that we could do. And Rick was very, very helpful to the point where he helped craft a proviso that would really streamline the process and really get the renovations for the regional centers into one master plan, which is really what we've needed all along. Instead of going one thing at a time through the CPIP process, what he's proposed to do is that we get each assessments done of every building, of everything that needs to be done at every residential building, at every regional center. And then we take that plan in one package, to the Joint Bond Review Committee. If they look at it, they make sure the priorities are right. They, you know, they review it and it meets their specifications for priorities and everything. And then they approve it, and then we're able to go forward through the, and be able to just procure contractors to go ahead and do the work. It cuts out the CPIP process that Andrew's going to talk about here. We're talking about, you know, he's going to talk about that we've moved a lot of money into the CPIP process. This year, you're going to see that with what he's talked about. But what this would do would overcome that, and it would allow us at the regional centers to be able to do this maintenance on a much quicker basis, where we're able to bid out property, you know, bid out entire buildings and get all the work done at a building at one time, instead of on a piecemeal basis, which is going to be very helpful. So that proviso, Senator Bennett actually proposed that proviso on the floor of the Senate, got it into the budget. I was very gratified that we had 5 other state senators sign on to put their name on that as a co-sponsor on the on that. So we had a lot of support on the Senate floor when Senator Bennett came up, brought that up. So the regional centers have a lot of people are thinking about the regional centers. It's a lot of people want us to do this, including members of JBRC signed on to that. So that was very helpful. And so that gives me great hope. I've talked to the House. They don't have a problem with it. The governor's office, they don't have a problem with it. You know, as long as, you know, we're not moving money in the budget, we're spending our own money. So that makes it a little easier in the budget. So that's something that's going to be one of our agency provisos that's going to allow us to do that plan. So that's very exciting, and something that I think is going to pay great dividends and really allow us to do some work at the regional centers that we've needed to do for quite some time. So that's exciting, and you know, nothing's ever 100%. Knock on wood that we're going, you know, that is going to go. Senator Bennett is a budget conferee, so makes me feel a little bit better about it as well. So I think we're in good shape on that. Does anybody have any questions on that?
I have a comment. I think that's great, and I know that Andrew's going to talk about it more when we
Yeah.
get to the.
Yeah, you're going to hear about
Yeah.
specific work that needs to get done there at the centers from Andrew, and so it's something that it's really going to make his life a lot easier and really do good work for us. I think it's going to be able to make some real strides.
To have that support is definitely good.
One more question about that regarding the money of it. Excuse me, if you don't mind. So what you're saying is that the CPIP program money is really going to be transferred over to Proviso in order to be able to use right away, as opposed to, so we'll be transferring the money that we have down here on this CPIP.
We'll use,
basically?
I'll defer to Quincy on that, of how the process of moving the money will be. The money is there. That we
It comes out of
have.
our budget, but
Right, it's coming out of our budget.
Okay.
The money is there in the budget. And it's something that, how Quincy does it, he has a magic way of doing, you know, there are accounts that you have to, specific accounts you got to move it into, and it's got to be coded correctly. We learned that this legislative session as well. If you don't code accounts, you might want to put account with $1.8 billion in it that you don't know where they are, where it came from. But so we learned that in this session too. But so Quincy knows how to do that, and we will do that. It's something that JBRC knows, and they will direct the process of how to do that.
one basket is better than waiting Rob down with 100 baskets. So hats off to State Director and the entire executive.
Andrew's the
staff.
one that would have 100 baskets.
Yeah.
Yeah.
And to the Eddie Talon Group.
But, and just, you know, thanks to Senator Bennett, that was a tremendous, tremendous thing he did. It was it was a heavy lift, really. I mean, putting a budget proviso in on the floor, Carol can tell you. Most floor amendments don't pass. The vast majority of floor amendments don't pass on the budget. So so when you get one, that's substantial. All right. Anybody have any questions about that?
We appreciate it.
All right.
Thank you very, very much.
All right. Now we will move on to House Bill 4927 and Senate Bill 915. This is the bill that grew out of Act 60, passed last year in the General Assembly, that broke up the Department of Health and Environmental Control into two separate organizations, Department of Public Health and Department of Environmental Services. In that act, they also, the legislature directed the Department of Administration to procure a contract with a consultant to look at all of the healthcare agencies and how they work and the structure of how they are. In South Carolina, the contract was awarded to the Boston Consulting Group. Boston Consulting Group issued reports on October 1st, on January 1st, January 9th, and April 1st. In that regard, that January 9th report was one that became the impetus for Senate Bill 915 and later House Bill 4927. The bill does a few things. It creates what we call a health secretary, an office of executive health policy. That executive director or executive secretary is charged with doing a few things. Developing a health plan for the state, developing making the call when there are dual diagnosis cases that get between agencies. So he will direct agencies how dual diagnosis cases are going to be handled. Each department, of which we would be one. The other ones would be the Department of Mental Health, Department of Public Safety, or Public Health, Department of Alcohol and Drug Abuse Services, Department of Aging, and us, and the Department of Health and Human Services, which would become the Department of Health Finance. Those are the agencies that would be brought under it. There would be 5 agencies. As I said 6. I named off 6. They're going to merge the Department of Mental Health and the Department of Alcohol and Drug Abuse Services. So that would create a five agencies, and they would remain as departments. We remain as a separate agency. We would keep our line item in the budget, our J160 line item. We would keep our in part 1 of the budget. In part 2, we would keep our section 36 in the budget. We just would be governed by the health secretary, who would serve on the cabinet with the governor. The other, there are name changes that would come along. Our name change would be to the Department of Intellectual and Related Disabilities. That would be the new name of the agency. And then beyond that, each bill or each house in the legislature made different changes. They added, the first thing they added was what they call the DHEC enabling legislation, which is the changes of the statutes that are required for DHEC to break into two separate entities. The second part of it was recommendations from the Boston Consulting Group, specific recommendations from the Boston Consulting Group, which they also, in the Senate side, have called enabling legislation. It's basically changes to statutes and they've moved some things around. Without getting into too much detail, the Senate version of what the Senate adopted, much larger than what the House did. The changes that would happen for us, the main change that's different between the House and the Senate for this agency, other than the agreed upon that I talked about earlier, changes, would be that the BabyNet program. As you know, we do early intervention it's a 0 to 6 program, but we have the 3 to 6 category that we administer, and then Health and Human Services administers the program from birth to 3. That program would come over to our office in the Senate version. It is not in the House version. The House did not adopt all of the BCG recommendations. The House also made a few other changes. Well, the Senate. Well, let me do one more change the Senate did. The Senate that will affect us. The Senate directed the health secretary to hire an Olmstead coordinator for the state. The state does not have an Olmstead coordinator. Olmstead being the Supreme Court decision from that Sandra Day O'Connor wrote that dictated that people need to live in community settings and to put people in the least restrictive setting possible and to mandate that people get out of institutional settings and into settings of their choice in the community. That's something that would affect us, obviously, but that is not in the House version. The House did not include that. The House did include emergency powers, changes to right now, after 9/11, the director of DHEC, then DHEC, was given emergency authority to call out the National Guard for certain things and to direct the sheriffs of the state to deal with public health emergencies, and that was was used in some instances during COVID. That was an issue for people in the House, for members of the House, and they wanted to curtail that and basically move it back to the pre-9/11 version, where only the governor can direct the National Guard and the law enforcement of the state. So that is included in the House version, not included in the Senate version. What you have in front of you are differences. I gave you one page of what's agreed upon and then what's different in each House and Senate version. Then you also have an overall view, what we call the Hogan copy of everything that's in the bill.
Medical Affairs Committee, Mr. Chairman, the research director of Medical Affairs Committee has been very helpful. Danny Burden, I've contacted him, and he's been working with Carol and Rob to kind of get us information so that our attorneys will have the latest, and basically working with 915. But I have a word to say when he is finished.
Okay.
Thank you.
Gene Hunter knows his stuff and gave a great summary of the bill. There's also a floor copy that Senator Davis used on the floor when he introduced the bill. So that's what you have. And then also I gave you a timeline of how the bills move. I need to say something about that. The House and Senate introduced different bills. So 915 began to move first. A week later, the House introduced 4927, which is it was exactly the same bill. It was amended differently in the process, but the bill, the shell of the bill was the same moving through. It was passed. Both of those bills were passed by both houses in the General Assembly fairly quickly. Senator Thomas talked about the old days. It used to be in the old days. You remember in the old days, we used to, when you started bills in the House and the Senate, we used to be able to take two bills to a conference committee. I remember that back when I was in the Attorney General's office, we took the DUI bill one year. I mean, we did that with the DUI bill 1 year. And so that is something that the rules no longer allow that. So that is what happened with this. Both bodies passed their, and everything stopped for about a month. Then the House picked up in the last week of the legislative session, or the last 3 weeks of the legislative session, the House picked up 915, moved it through committee and onto the floor of the House. They amended it back to the House version. It was the Senate. This is the Senate bill. They took out the Senate amendments and amended it back to the House version. Added a few amendments. They added on the floor. They added a couple of amendments that were different. There was no advice and consent for the component agency directors. Okay, so the directors of each department would not have to be approved by the Senate, only the health secretary. And then they approved, then they said that the House has to provide advice and consent for both, both the House and the Senate have to approve the appointment of the health secretary. That was a change they made on the floor. They also, the other floor amendment they made was that when the health secretary makes calls between dual diagnosis cases, that cannot override the doctor-patient relationship. So they made that clear in the House as well. So a couple of different versions. So they've changed it. They sent it back to the Senate. The Senate amended it back to their version, which they usually do. They amended it back to their version. They said, take out all the House amendments, amend it back to what we gave. Then they put a few more amendments on it, which amounted to the vaccine bill, which is basically the vaccine bill that Senator Martin sponsored. Basically, it's an outgrowth of COVID, where it basically said that the state agencies cannot mandate novel vaccines for people, for employees. So that was put back on the bill and sent back over to the House. That happened on the last day of the session. On the last day of the session, the usual process is to waive the normal rules. The normal rules is a bill has to stay on the calendar for 24 hours before you can take it up. The idea is for that, the old days, the House calls it, the House still calls it waive the printing of the bill. Nobody prints the bill out, but they waive the printing of the bill is basically to make sure that members have the ability to read the bill before they debate it. Usually they will waive that takes unanimous consent in the House, and usually you get unanimous consent on the last day for bills that aren't controversial to move over a bill that both houses have passed. It looks like this thing's going to a conference committee, and one member of the House objected to the unanimous consent, and that was able to stop it. They were not able to take it up, and as we watched the last hour tick out, away, and he never removed his objection. And at 5 o'clock on May 9th, the legislature came to an end. And anything that's not on the sine die resolution, which would be all of the ones that were passed and gone to conference committee, die. So that is where we are now. I know you've probably read in the paper. I have very little information on this. This is something that would happen amongst legislators. I know Senator Davis would like to amend the sine die resolution to allow the legislature to take up 915 when they come back. They're coming back for 3 days in June. He would like to be able to do that. I don't know what his success is going to be for that. I don't know what kind of success he's going to have with that. He's going to try. I will just say I was asking Senator Thomas if he ever remembered anybody reopening the sine die. I don't think.
If I could jump in, you mind?
I don't remember anybody reopening the sine die.
He's done a real good job wading through the procedural weeds, and I wasn't actually going to go there, but that was a very good rendition of what's taking place. The problem is that they're facing, and you'd always face if you want to open up your sine die resolution. That's the concluding things that can be taken up in a future session 2, 4, 6, 8 weeks later. All right, so if you open it up for one, then it's wide open for anything. And that's a sticky wicket, man. So probably it doesn't work to do that, meaning that the bill likely will not be taken up until next year. Okay, so we continue, and all the other agencies continue as is. To speak for a moment about what's in and I've got the whole proposal here that would have passed, and thank you very much for Carol and y'all getting this together in time and I wanted to make sure our staff, I didn't know what for sure they had, but you don't want to have something that's dated, and this is pretty much up to date. Now, when it's revised again, you're going to find some revision, but you've got the clear intent that we know that's here. And that just to speak to some of the content that is very important, this does not eliminate positions. All the positions of staff are just as they were. So staff workers in every division and every aspect of all the agencies, and I speak especially obviously to Department of Disability and Special Needs, or whatever we want to call it in the future, but nobody's going to lose their job. Everybody's got their jobs. If there's some degree of overlap, that's going to be ironed out. And if there are changes, it's always done by attrition. But there is no targeting of reduction of staff. This is a coordination effort. The problem has been there's not enough coordination. We ran into this 3 or 4 years ago and had to pull Robbie Kerr in because we were having some difficulties in getting things done, and whether it was a staff problem, sort of coordinating with with Robbie's group, or not, it never was clear. But once Robbie got involved, well, that's the sort of thing we're talking about. It's the coordination at that level. So just to let everybody know what I have deduced from this and talking to various folks, that is it. There's no targeting of like changing position issues. So if anybody has a problem wondering, don't worry about this. This is not going to happen. I mean, you're going to be totally safe, and we need you and we love you, and that's not the target in this bill. This is a coordination effort, the czar idea. Now, whether the czar idea flies or not, Mr. Chairman, ultimately, that's where some of the contention is. Do we want? And I'm not in the legislature anymore. I know what I'd do if I were still a state senator, but I'm not, and nobody cares. But it's an effort to try to coordinate what has been somewhat confusing coordination, lack of coordination, where there does have to be the alignment necessary. So that's what I think is behind the governor's pressing this issue, and where I think Senator from Beaufort, Senator Davis is coming from, and has nothing to do with the elimination of positions. So there you go. Am I speaking correctly?
That's correct, that's correct.
Second big ticket item, and I'm out of the discussion at this point. I've been asked this a couple of times, the 37 independent groups, the DSNs are not in the bill. It's not spoken about. But if this goes to conference committee, it's possible anything can happen in a conference committee. And free conference is wide open. Free conference is wide open. Yeah, so if they get free conference, they can do what they want to do, basically. So I would say to any of the 38 agencies out there that are concerned about being put under the umbrella, I like the idea, everything being covered, but, that's another sticky wicket, because everybody loves their independence, and I understand that. But that's not in this bill at this point.
It's never been in the bill.
Never been in the bill.
Never been in the bill.
Thanks for that clarification.
That's it.
What we will do as a commission, we will yield to you because you have a lot of reading to do.
Yes, I do. It's front and back of this page too.
Yeah, so what we'll do is we'll hold and wait on you and the honorable and the commissioner, as well as Mrs. Stewart and the Robbie of the world, to get back to us. And then we will know how we will have our discussion so that we'll know how to.
And I'm interested in our executive director, when Constance has a chance to really, I'm sure everybody, including legal staff here, has had a chance to go through it, to basically inform us if there's some bomb in there or something, some phrase that takes out something somewhere you just can't, it's hard to master the whole thing. You almost need a real legal mind. I am a lawyer. Wait a minute. I take that back. I didn't know where I was going for a second, so I retracted. I'm finished saying.
Okay, but your role, you know your role.
Yes, sir.
All right. So rather than for us to get into the weeds now, we will wait for you to come back to us, and you touch any place in this where you have to come back and be prepared to tell us what we need to know.
Thank you.
Well, there is one thing I'd like to bring up, if I could, very quickly. Regarding the commission itself, we all realize that this makes the commission advisory. But my question is, and Carol may be able to answer it, or Rob, I don't know. But my question is, in the two bills, which I've read before the last one came out, it said that there was 3 different advisory committees in the Senate version, and only 1 advisory committee, as I understand it, in the House version. So my question is, how does that stand now? Is there going to be 1 advisory committee, or is there going to be 3?
Well, the Senate bill is the bill that was sent, is the vehicle now. It's the Senate bill is the one that was sent back over, that was on the floor in the House. So the Senate, as it currently stands, the Senate is, the bill reads in the Senate version. There is no, I never like to be absolutely certain, but I'll be absolutely certain that the House will not agree to the Senate amendments in total. This thing will have to go to a conference committee, I would think.
Well, we don't stay, but
we can't get, but we're not getting there until this thing is, we're talking about something that's theoretical.
We really,
We're talking about something that's theoretical.
Why don't we just wait, and we have Commissioner Thomas.
I'm giving you my 2 big talking points.
He has a good head on them, so we'll get to that point. Let's leave it where it's at.
But the bill is, as originally written, the bill, each agency that has a commission now would have an advisory, the commission would just become advisory.
We just don't know the fallout yet.
And it's up to the health secretary to appoint those.
Right.
We don't even know if it's gonna come back. And it's gonna be a heavy lift.
That's right.
Which is why you see all the editorials and the headlines trying to push the legislature to reconsider.
This bill has died and come back to life a couple of times already, so, I don't.
But today it's still dead.
Today it is currently dead.
The last thing to say very quickly, is I asked that these, questions about the bill be answered in the minutes that we approved. So could somebody send me in writing the answers to my questions that are in the minutes?
Actually, I answered them in the timeline, I think.
Oh, you did?
I answered them in the
Well,
timeline.
look, y'all, we can do with questions and questions and questions, but the chairman has spoken, and I agree with that. We got a lot to cover. And the executive director, legal staff, and we'll have plenty of time and you know, during the interim, I mean, the next few days,
Absolutely.
week, 2 weeks to pass questions around. So if we could move on, and that will be
Right.
covered. All the questions you can
I only have one.
ask.
I only have one other item to talk about, and that is something that I know, I think is something that I, for the agency, is very proud of. It's not something that I had a whole lot of. Quincy Swigert is really the guy who pulled a lot of this information together, along with Lori and Janet, pulling this information together. What we try to do this legislative session, because senators and House members ask us, you know, they interact with their DSN boards locally, and they always want to know what the connection is to us and what, how is their DSN board doing? What, what's our, and do I send people to the DSN board? Do I send them, how do we do it? In an effort to educate the legislators about the DSN boards, about what is available in every one of their counties, and what the status of each one of the DSN boards in each county are. We did a one-page scorecard on the front and back of the of this. Every DSN board in this report has a scorecard. It gives you the members of their governing board. It talks about people eligible for their services in the county, how many they're serving in their county, and what services they offer. It gives them there's some quality information of their scores for that. And then it also talks about folks from their county that are on the residential wait list. And then on the back is all their financial information that we have available. So that's something that we wanted to make available to the legislators, and we put a key in there. We've gotten really good feedback on it, and it's something that it's great that when I get calls, and especially in the out of session time, I can refer to this book and I can tell the legislator, hey, pull your blue annual report out, and we'll walk through it. I'll tell you what, where you are and what goes. And this is a 2023. The latest data we have for each one of the boards, but it's something that we hope is educational for the legislature, and for other government officials as well. We'll hand those things out to folks during the years. Anybody that has questions about how the DSM, we have other agencies that ask how the DSM boards interact with us and things like that. So it's something that will be helpful in the future. I just want to thank Quincy for putting all that together.
Excellent work, and it's great for us, all of us. So hats off to everyone that had a hand in this.
Yeah, it's a great report, and hopefully we can build on it in the future. After that, there are no other questions. That is my report.
That's your brief report.
That's a brief report.
Okay, David. Okay, Mr. Navy. Okay, next on the item is number 10. Tab 5, 24, spending plan budget versus actual expenditures. Bruce Busby. Mr. Busby, how are you?
I'm good. How about yourself?
Air Force man, I'm fine.
That's the standard answer, right? We're all fine. Actually, Quincy asked me to present today, just give a brief update. I will not be 45 minutes.
Well, that was necessary. That 45 minutes was necessary. Yeah,
But
so
my
we
brief
appreciate it.
report will be brief. So, On tab 5, you'll see the update for the adopted FY24 spending plan of $329 million. That was actually increased February 15th at the commission meeting because of increasing cost of contracts, linen, retherms, things of that sort. Through April 30th, the agency has spent $283 million in agency cash and puts us slightly over the commission's approved spending plan. But by 2.74%. However, when we receive funding, when we receive our billing from Department of Health and Human Services, we'll be back in line. Some of that over expenditure is also projected over expenditure is also kind of inflated because we have a lot of one-time costs that we pay up front. And then, so as we get towards the end of the year, it looks like we're spending a little bit quicker than what we should be. But by the end of the year, we will be right on target and where we're supposed to be. And that's really all I had today.
Man.
I told you I'd be great.
Okay. Next, one question if I can.
Yes, sir.
Where it says fixed charges and rent and lease, is that relating to our new building? In this,
No, at this point, none of those are related to the new building. All of that is currently what we spend here throughout the agency on various fixed charges, such as leases for copiers, things of that sort, as well as rent and any lease equipment.
All right.
Okay, thank you.
Annual Comprehensive Property Implementation Plan. Andrew, how do you pronounce the A in your name?
It's Andrew, yeah. Andrew Thayer, last name Thayer, yeah.
Thayer.
Yeah.
I don't, being an Air Force man, I don't want to mispronounce your name.
I got you, I appreciate it.
All right.
Commissioner Miller. Good morning, everyone. I guess it's still morning time at Rob.
Leave my man alone. Don't bother Rob.
I am here today to present the annual 5-year CPIP plan. This is something I present to the commission every May, so we're on schedule this year. But before I get into all that, I just kind of briefly want to touch on the proviso that Rob mentioned. That is really big for us. It will really change the way we do construction here at the agency. And when I say it's changed the way we do construction just like every other state agency. We're regulated by Department of Admin. But what that proviso will do, it will create a fast lane for us. For example, some of the projects I presented in our year 1 CPIP plan last May, we won't expect full approval, full funding on those projects. I've got 4 of them that we're expected full funding for towards the end of this month. Most of them we won't see till August. I've got 1 penciled in that we won't see full funding for until October. So it takes, year and a half to get these things off the ground. Now it won't eliminate all of that time, but it'll cut it in about half. So that's what that proviso will mean for us. So it will be big once that thing goes into effect. But until it does go into effect, we got to continue on business as usual. So that's what the CPIP plan here is for that we're looking at today. Some of you guys might ask, well, what is the CPIP plan? It is a 5-year capital improvement plan that every state agency is required to submit annually. The year 1 projects are stuff that we're looking to open up immediately, and that's one of the things that we're here to ask for approval for today is to open up those year 1 projects so we can get them started. But it's a 5-year plan that looks at all the plans or all the projects that we have over a certain threshold, which is $100,000 that we want to implement in the next 5 years. And a lot of them are consistent, major roofing projects, major renovation projects. You see a lot of HVAC stuff just due to the price on that kind of stuff. This plan is due, again, by every state agency, June 14th. So we bring it to you guys to get your approval before we take it downtown. And then once we do, again, we're going to open up all those year 1 projects. The main thing that jumps out at me on this CPIP plan is the price. Last year with the $12 million that we submitted, I thought that was a big step in the right direction. this year, we've identified $31 million of capital projects that we want to pursue next year. So I really think that's big time for us. It's far more than we've ever invested into our regional centers in the past. So it's a big step in the right direction with regards to improvement to our facilities. So with that said, is there any questions about the plan or how the CPIP process works?
You know, I'm familiar with it. I'm a construction manager, project manager, so I'm very familiar with it. I'm in the room with you.
Well, proviso, Mr. Chairman, the proviso's in the budget. I mean, it's a budget proviso.
Correct.
All right, that's good for what? That's good for a year. What are you going to do the next year? Going to do the same proviso?
We'll carry it over as long as the.
Well, you need the legislation if you can get it.
Yeah, what we'll do is.
Carol.
We will put it in the agency proviso, in as an agency proviso. But really what this is going to be is a one-time approval from the JVRC.
So that's all we need?
What's going to happen
is that all we need, the 1 year?
Andrew
Sir.
right now is putting together for JVRC a report that and he's hiring folks to do assessments of all of the regional centers.
I got that.
And what we're going to do is so the way the proviso reads is that once JBRC approves the projects that are listed in that report that we will bring them, they are considered legislatively approved. So we have legislative approval from there on.
No, you don't.
Yes.
Who gave you that? Who gave you that?
Yes.
I want to see an attorney general's opinion on that one. Provisos are only for 1 year. You can't bind a future legislature.
But the project is it
might be
goes
the money's not
periodically
there.
back. No, well, it goes periodic. We periodically give updates to.
All right, you guys better make sure of this because you might have the rug pulled out from under you. In my opinion, what you need is a piece of legislation. The proviso is only good for one budgetary year. You cannot bind a future legislature.
It's the same proviso that the universities use.
Oh, well, them too.
Universities use.
We're a university. We're exempt from the proviso rule. No, they're not. They just keep rolling it over. And I'm saying, look, all you need is a piece of legislation in place of the proviso.
I hear what you're saying.
Then you never have to worry about it.
I believe the way it works.
Is the legislature really gonna want to pull? I mean, they could theoretically, yes, they could theoretically pull the plug on.
Well, then
they pull the plug on anything. I mean,
you may effectively be exempt. Okay.
But you know, realistically, are they going to pull back from JBRC that authority? You know, like I said, they don't usually do that. If they want to stop work that's happening on the regional centers, they can. That's their prerogative. But a proviso has the force of law.
Put in the minutes that David Thomas said, watch out for a proviso only lasting a year. And yes, they usually roll over. They don't always, and it would sure be nice to have legislation. That is my suggestion to the big boss.
I am just the engineer, I'm not a lawyer or politician.
And it doesn't mean that we can't go back next year and try to get permanent law, but to fix this problem now, because that coastal center really needs this work done now. Senator Bennett said the easiest way and the quickest way and the most assured way of getting this done so we can go ahead and get started on it.
Yeah,
Is
provisos
to
are
go
good
ahead
for
and
that.
put it in the budget.
Now, if it
because
requires
that's time.
future funding for other things, then you're expecting the proviso to be there, and I've seen them pulled before. So you don't want to find yourself in that ridiculous situation where all you had to do is just duplicate the proviso in a standing legislation.
Rob's right.
If Carol and I do our jobs, they won't pull it.
Yeah, again, the way I kind of understand it works, I see what you're saying, but in the proviso, it says once we get this packet approved, it's legislatively authorized, which avoids the red tape through the phase 1 to phase 2 approval process.
I understand what.
Yeah, I do as well.
Let me make one thing clear. When the Army, the Navy, and the Marine are talking, the Air Force only fly. Thank you.
Thank you.
But you know, all that aside, you know, I expect Rob to diligently look into that and push this thing forward as long as possible. But Again, I can't stress enough how much I think this plan in front of us is a huge jump in what we've done in the past.
Thank you, Mr. Chairman.
All right, what's your motion? What do you want to happen now? Motion to
So
approve?
what we're looking for is to approve the 5-year plan for submittal down to Department of Admin next month on June 14th. And then we would like approval to immediately when that happens, to open up the year 1 project so we can start that.
I so moved, Mr. Chairman.
Do I get a second? All in favor? Ayes have it. You got it.
Thank you, sir.
Shall you have rules? What's next on the agenda? Ooh. Yeah, director's update.
Maybe a little bit more Rob, I don't know.
Rob is my man. Don't bother Rob.
So good morning, everyone. I'm gonna take a few minutes. I'm gonna be brief and take a few minutes to provide an update on things that have been happening at the agency over the last couple of months. So rather than providing my usual employee spotlight, I'd like to spotlight all the nominees for DDSN Employee of the Year Award following yesterday's recognition here at Central Office. We are proud to announce that this year's Employee of the Year is Stanley Livingston, a direct support professional 3 at our Millens Center. Stanley is a valued member of the Millens team and has been with the agency for nearly 40 years. The facility administrator of the Millens Center is Gene Bowman. Gene Bowman says about Stanley that Stanley is a hard worker who always goes the extra mile for his fellow DSPs and others on staff. The other nominees from the other regional centers include Sharon Gurley, who is a DSP 3 at the PD Center, Dana Isgett, who is a physical therapy aide at Salibi, Kendra James, who is a workforce specialist at Witten, and Shakia Russell, who is a DSP 2 at Coastal Center. We had a great time highlighting them yesterday and recognizing all their hard work and showing them how thankful we were for everything they do for DDSN. I'd also like to recognize our HR department here at Central Office and all our HR leaders at our regional centers. This month, we're still in May, right? This month is Employee Appreciation Month across the statewide. So HR has been working very hard to appreciate all our employees this month, and our staff are enjoying various lunches and events that are planned across the state. I believe this month is also National Nurses. There was a National Nurses Week that fell in, and we highlighted some of our nurses out on our billboards across the agencies. For our agency updates, let's see, our engineering team reports that we had our final inspection for our last week for our interactive garden. Andrew, I still have my gold shovel if y'all need me to come back. I'm ready to work.
You get back out.
I got mine too.
We also expect to get additional funding for more plants for the garden later this month. Our CPIP that was just presented by Mr. Andrew Theron has $31 million in capital projects scoped out for next year and $129 million over a 5-year plan. We will provide updates to the commission on those projects as we receive them. To highlight our eligibility team reports that they continue processing hundreds of cases each month, ranging from basic determinations to reevaluations, appeals, requests for parents, medical entities, courts, and other agencies. Elsewhere, transition coordinators for DDSN's adult supports divisions have attended 536 events across the state since August 2023. Those include transition fairs, resource nights, parent information sessions, etc. Those efforts have resulted in 226 referrals to DDSN eligibility with an eligibility rate over 84%. Family, teacher, and stakeholder feedback has been overwhelmingly positive, and the demand for transition coordinators to attend local community events continue to rise. I also want to highlight last month, no, it might have been this month, all of my months are running together. This part of last month, Autism Connect. Guys, somebody in the room. Last month. DDSN partnered with the University of South Carolina for a resource fair put together by Stephanie Turner here at DDSN with the help of the communications team and other executive staff members. And they hosted an event where there were over 50 exhibitors, 27 presenters, and a total attendance of about 500 attendees, which included residents who received valuable resources. We also had several media outlets come and do great stories about the resources that were provided at that. Rob stole some of my thunder, but I wanted to make sure I thank particular entities. I want to thank personally SLED for coming this month, last month, all my months are running together. SLED came here and personally presented a A&E training for central office staff. It was well attended. My understanding, it was well attended. I wanted to thank them for that, taking their time out to plan that training and come here personally to do that. I want to thank Senator Bennett and Mr. Rick Harmon for their assistance with the proviso. They called us down to the State House for a meeting and said, what do you need to get this done? And they worked very quickly with members of the executive staff team, to include Rob and Andrew and Quincy and Courtney. Courtney's also now going to be part of the engineering team. She doesn't know that, but she's also part of the engineering team. And we were able to get that proviso in. I want to thank Quincy and all the staff who worked on the scorecard. That was a lot of months of tedious work. I want to also thank the providers, the DSM boards, for providing their feedback. We got their feedback before we published the report. I want to thank, I know we're joking about you, Rob, but I want to thank Rob and the Italian group, particularly Carol. This legislative session, I particularly don't pay attention a lot to legislative sessions because they're so good at what they're doing. But I've been paying attention, particularly in reference to 915, and they have been on it. They have been keeping us advised, and I appreciate all the hard work y'all have been doing in the effort to that. I think that is it for my updates. It's good seeing you guys again.
Same here. Now, we're gonna give Rob, when we say 45, everybody in this room knows.
45.
45.
25.
But on behalf of this commission, want to ditto what Constance has said to all, and especially, what is it, Stanley Livingston, and who were the others?
Stanley Livingston, and we had 4 other employees, Sharon Gurley, Dana Iskett, Kendra James, and Shakia Russell.
So commissioners, what say you about those individuals?
Yay.
Happy for them.
Thank you, Chris, and to the executive staff. You guys are doing a wonderful job. It makes our job easier, and we are appreciative. We don't want our flowers after we leave here, right, Commissioner Thomas?
Well, good point. I'd sure like to be alive and functioning when they move into the, what's the name of that big fat?
Terry Park.
Moving up.
Parkway.
Yeah.
Well, because I do hear it is a fabulous building. Scannell was only in there a fairly short period of time, wasn't
And they spared no expense.
I would love to see what the commissioners' quarters look like.
Yeah, like when we're gone.
So maybe what you need to do is schedule something so we can actually see where we go.
Where we would have been.
Yeah, whether we want.
We started making a lease payment.
With that said, I need a motion to adjourn.
I'm ready. Let's go.
Do I get a second?
Let's go home.
All in favor?
Aye.
Ayes have it. Thank you very, very much.